Hello everyone. I hope you all are doing good. Yogpath Wellness welcomes you all to today's weekly Yog Group Doubt session. My name is Rashmi, and today we will discuss and learn about some sitting postures, or you can say the sitting asanas. These asanas helps in three ways. First is it toned up your abdomen muscles. Abdomen muscles like rectus abdominis and oblique muscles. They help to tone up your abdominal muscles. Second way, it strengthens your spinal cord and increase the flexibility of your spine. The third way it helps, it increases the blood flow towards the brain for better concentration power and the focusing power. So by these three ways, the sitting postures help us in mentally and physically. Before starting the actual session, before starting the actual practice, I would like to request you all, and I would like to inform you all that you should listen your first of all the limitations of your body before practicing any yoga posture, any yogic exercise. Know your limitations, do the practice as per your limitations, as per your capabilities. Before doing any yoga asana, it is important to listen your body first. I hope you all understand and ready to know the sitting postures. So let's start today's session. First, I will explain you these asanas, and then after the explanation, we will demonstrate or practice these asanas. Let's start. So our first sitting posture is Ardha Matsendrasana. Ardha Matsendrasana is also known as the half Lord of the Fishes pose. Why it is called Ardha Matsendrasana? It named after the Yogi Matsyendranath. In 9th century, he formed Hatha Yoga, and he is the first yogi of Nath Sampradaya, the Matsyendranath. He is the first yogi of Nath Sampradaya, the first guru of Nath Sampradaya. In his name, this asana is known as Ardha Matsyendra Asana. One another reason it is known as Ardha Matsendrasana because Yogi Matsyendranath do his practice the entire sadhana in this posture. He performed the Purna Matsendrasana. But as a beginner, as an intermediate, we will perform the Ardha Matsendrasana first because the Purna Matsendrasana is very hard to perform in initial stage. So today, we perform only Ardha Matsendrasana and knowing about the Ardha Matsendrasana. It is also known as the sitting spinal twisting posture. It includes the rotation and twisting of the spine in a sitting position. It is very beneficial for improving the flexibility and increasing the strength of your spinal cord. It also improves the digestion, digestive fire, digestion. It also improves the digestion, and it removes the toxins from your body and also cleanses your body, your whole system. But it have some complications too. If some individual is suffering from peptic ulcer or hernia or any slip disc problem, any recent injury, severe injury, any recent accidents, so they should not perform this asana, the Ardha Matsyendrasana asana. So let's move toward our second asana, which is Paschimottanasana. Paschimottanasana is also known as sitting forward bend or sitting forward stretch. As it is clear by its name, sitting forward stretch is performed in a sitting position, and in Paschimottanasana, we stretch our back. Paschimottanasana is a Sanskrit name which is derived from the Sanskrit word Paschim. Paschim means the backside and Tan means the stretching. So in Paschimottanasana, we stretch our backside in a sitting position. Paschimottanasana is a very powerful asana. It's one of the most powerful asanas in Yogasana series because it has many beneficial effects in our body. First beneficial effect is it improves our mental health because the blood flow in Paschimottanasana is go forward towards our brain. So it improves our cognitive skills, our communication skills. It enhances our frontal lobe, the frontal lobe of our brain. So it has many beneficial effects, especially in a mental health. It also reduces the stress, anxiety, depression, these kind of mental health issues. Helps to reduce this. Now, it also has some complications. If someone having the stomach infection or any stomach related surgery, so they should avoid the Paschimottanasana. Also, if someone having any severe injury on the back side, on their spine or on their back, or in the lower extremity, they should also avoid the Paschimottanasana. And if you are suffering from the high BP, high blood sugar level, you also avoid Paschimottanasana. Let's move towards our next asana, which is Baddha Kona Asana. Baddha Kona Asana is also a Sanskrit name and is derived as a Baddh means the bounded, and the cone means the angle. That's why it is also known as the bound angle pose. So Baddha Kona Asana is also famous as a butterfly pose, butterfly asana. In Hindi, we can say the Titli asana because it includes the upward and downward movement of knees like a butterfly wing. Baddha Kona Asana also have beneficial effects, especially in the lower pelvic region. It strengthens your lower back. It improves the range of motion of your pelvic floor muscles, and also enhance and it is also beneficial for the hip joint mainly and all the lower extremities. It tone ups your calf muscles, your hamstrings, and all the lower extremities. There are some complications of Baddha Kona Asana. If some individual is suffering from the knee injury like ligament injury or the joint inflammation, any abnormal kind of inflammation in your body like edema, rheumatoid arthritis, so you should avoid the Baddha Kona Asana or the butterfly pose. But the butterfly pose, the Baddha Kona Asana is very, very beneficial for the pregnant ladies. And we discussed earlier the Paschimottanasana is contraindicated for the pregnant ladies. So please note it down that Paschimottanasana is also a sitting posture and Baddha Konasana is also a sitting posture, but they have different contraindications and benefits for a pregnant lady. Like Paschimottanasana is not recommended for the pregnancy and the Baddha Konasana is must recommend for the pregnant ladies. Let's move forward to the next asana, which is Vajrasana. It is the most powerful asana in the yogic series or in the sitting postures. Vajrasana. Vajrasana is also derived from the Sanskrit word Vajra. Vajra is a nadi in our body which is located in the Mooladhara chakra, and it rises up from the Mooladhara chakra within the Sushumna Nadi. It have two main functions. First is it channelizes and energizes all the 7 chakras in the body. And the second function is it it controls the vital energy or the pranic movement, astral movements, pranic movements of the body. Means the pranamaya kosha. It also affects the pranamaya kosha. So let's discuss the chakras. There are 7 main chakras in our body. First, start with the Mooladhara chakra, the root chakra. So the Vajranadi rise up from Mooladhara chakra. Then it goes to the second chakra, the Swadhisthana chakra. Then to the third chakra, Manipur chakra. And then fourth is Anahat chakra, Hriday chakra. And then the Vishuddhi chakra, which is located in the throat. And then the Ajay chakra, which is located in the forehead, between your eyebrows. And then the last sacral, then the last Sahasrara chakra. So Vajra Nadi plays a very important role to all these chakras. And second, it is very important for our pranamaya kosh regulation. We all know that we have 5 koshas. 5 koshas means the Annamaya kosh, Pranamaya kosh, Manomaya kosh, Vijnanamaya kosh, and the final is Anandamaya kosh. So the main impact of Vajranadi is in the Pranamaya kosha, the second kosha, which is form of energies. Annamaya kosh is form of Anna. It is very gross, but the Pranamaya kosh is subtle. Then the cross body. It is made up of energy body. This energy formed by this and channelized by the Vajranadi. So Vajra asana is very, very important sitting posture, very powerful sitting posture. In English, we can say the Vajra is thunderbolt. So it is also known as sometimes thunderbolt pose. We can say Vajrasana is a thunderbolt pose or posture. Vajrasana having many beneficial effects in our body. It has many benefits. Like first, it improves your digestion. Second, it regulates the blood sugar level. So it is very good for diabetic patients also. It improves your concentration. It also improves, for example, I said that it improves all the chakras. It can affect all the chakras. So it can be beneficial in every form, in each form in your body. Digestion, respiration, excretion, every system of your body, it helps to uh, mm, organize all the organs, all the systems in the body. But it also has some contraindications. Like if you are suffering from slip disc or lower back injury or having any lower extremity issues, any swelling in your lower extremity, you should avoid Vajrasana. Vajrasana is very beneficial if your practice is after the intake of food. At least for 5 to 15 minutes are sufficient to sit in Vajrasana after intake of food. It's very good for digestion. So these are some sitting postures we discussed about, and now we are going to perform these asanas. How to perform these asanas? Now I demonstrate these asanas. So let's practice with me. Take position. Come to any Sukhasana on your mats. Take a deep breath in. Exhale out. Inhale. Exhale out. Again, before practicing the asana session, before practicing this demonstration, please listen up your body and your limitations of your body. Please do not do any excess stretching of your body. Okay, so let's start today's session. Are you ready to demonstrate, to practice? Okay, so let's start with our first asana. We discussed about first asana is Ardha Matsendra Asana, or the half lord of the fishes. Ardha Matsendra means what? Ardha means half, Matsya means fishes, Indra means lord or the king. So it is Ardha Matsendra, so it is the half lord of the fishes posture. Let's perform Ardha Matsendra Asana. First, come to the Dandasana. Dandasana means slide forward your both legs in front of you, both palms beside your thighs. This is called Dandasana. This is also a sitting posture. But now we are performing Ardha Matsyendrasana. Bend your right knee like this. Bend your right knee and uplift your left knee and place your left foot outside the right knee. Come to this posture like this. Okay. Now inhale, raise up your right arm and put your right hand in the outside of your right knee like this. Okay. Now the another hand, the left hand will be give the support to your back like this. So this is the Ardha Matsyendrasana. Now slightly twist backward towards the back hand and hold it for a few seconds. Take a deep breath in and exhale out. Inhale, exhale out. This is Ardha Matsyendrasana. Now come back from this asana step by step. Okay, come back to the normal position, the initial posture, Dandasana. Now we will perform this Ardha Matsyendrasana from the another side. Bend your left knee, put your right foot outside the left knee, raise your left hand and grab your right foot. Another hand on the back side, twist backward and hold for a few seconds. Take a deep breath in and exhale out. Inhale and exhale out. This is the Ardha Matsyendrasana. Come back from the posture step by step. Again, sit on Dandasana. Keep your back, keep your spine straight, your neck straight, hands straight. Shake your both legs before practicing the next posture, next asana. Okay, so our next asana is Paschimottanasana. We have to stretch our back side towards the forward. Let's start with the inhale, raise your both arms up. Now exhale, go forward. Try to grab your toes with your fingers as much as you can, go forward. And now try to down your both elbows and then go forward as much as you can. And hold here for 10 seconds. Normal breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, and then inhale, come back. Both palms beside your thighs. Okay. Now again practice the Paschimottanasana for the seated forward bend, forward stretch. Start. Inhale, raise both arms by side. Exhale, go forward as much as you can and hold there for 10 seconds. Normal breathing. Inhale, exhale. 1, 2, 3, 4, 5, 6, 7, 8, 9, and then inhale, come back. Okay, now the last set of Paschimottanasana, third set, repeat. Inhale, raise your both arms. Exhale, go down, go forward, stretch your back. Go forward as much as you can as per your limitations of the capacity of your body. Hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, and then okay. Inhale, come back. gap between your legs. Again, shake your both legs. Now, the next asana which we will perform or demonstrate is Baddha Konasana, bound angle pose or the butterfly. Take position, join both feet together, interlock your fingers, grab your feet like this, take position. Okay, now move your knees upward and downward in a normal motion. Keep your spine straight, your neck straight. Breathing, keep breathing. Inhale, exhale. You can also close your eyes for feel this asana. It's a very good asana for lower extremities. It tone up your calf muscles, your hamstring, your quads. It's very good for your pelvic floor muscles, hip joint. It increases the flexibility and mobility of the hip joint and also increases the range of motion of your lower body as well as your upper body. Keep doing butterfly. Okay, relax. Come to the Sukhasana. Both hands on Yan Mudra. Inhale and exhale. Again, take a deep breath in. Exhale out. So, next asana is Vajrasana, the most powerful and the most beneficial asana is Vajrasana. How to perform Vajrasana? First, come to Dandasana again. Now, slide backward your both legs. Sit on your calf muscles. Try to put your feet as near as your buttocks. Both hands straight. Both palms on your knees. Keep your spine straight and close your eyes. This is Vajrasana. Take a deep breath in and exhale out. Maintain this posture for a few seconds. Okay. Slowly come back from the Vajrasana. Now, Dandasana. Shake your both legs. Sit on Ani Sukhasana. So, we discussed about the four asanas, the Ardhamastendrasana, Paschimottanasana, Baddha Konasana, and the Vajrasana. And we also perform these asanas. So, now I would like to call Shweta ma'am for the further session.
Namaskar. I hope you all are doing well. Let's understand about the another series of sitting asanas. I'm going to discuss the sitting asanas a lot from the series of Vajrasana. So, the first asana of the series of Vajrasana is Mandukasana. Mandukasana is a very powerful posture of sitting asana because it is come from the Sanskrit word manduk. Manduk means frog and asana means pose. So hence it is known as a frog pose. This asana is very beneficial for controlling the diabetes and it is also known as the primary asana for controlling diabetes. because it helps in improving the digestive organ, resulting it increases the quantities of insulin so that it helps in maintaining the blood sugar level in control. And this asana is also helpful in improving the blood flow, and it also beneficial in curing the insomnia. So the next is it helps improving the cardiovascular health also, because it has an intense stretch so that it helps in improving the cardiovascular health and removing the blockages related to heart. So the next benefit of this asana is it helps in the flexibility of the thighs and legs, and it also reduces the extra fat from the thighs and the legs, and it is very beneficial in improving uh, improving and curing the pain in knees, neck, and the back. It helps in cure that. Now, let's discuss about some of the precautions or the contraindications of this asana. The people who are suffering from high blood pressure, they should not perform this asana because it stimulates the blood flow levels. So, uh, as per the movement, what it happens when we sudden movement, uh, it stimulates the blood flow. So the sudden blood flow can exacerbate the symptoms of high blood pressure. So the person who have the high blood pressure should avoid this asana. The next, the person is suffering from any kind of injuries, especially abdomen and the spine injury, they should not perform this asana. And the people with the severe pain or any kind of pain symptoms, they should not perform this asana, especially in the knees and the spinal pain, they should not perform. Now, come to the Uttan Mandukasana. It is the another form of Mandukasana, another variation of the Mandukasana, in which in this asana we don't need to lean forward, we just have to, it is a front body straight. The Uttan Mandukasana is very beneficial again for the abdominal health, and Mandukasana and Uttan Mandukasana is also improving it also improving the Manipur and the Mooladhara chakra and stimulates them so that it improves the concentration level, enhance productivity, intellectual functioning, and the other sustained attention can be improved by performing this asana. So again, the benefits and the contraindication is the same as per the Mandukasana. So now next, I'm going to discuss is Ardha Ushtrasana. The Ardha Ushtrasana is again a Sanskrit term, which means Ardha means half, Ushtra means camel, Asan means pose. So it is known as also as the half camel pose. The half camel pose is a front body stretch and a backward stretch. So it helps in improving the spinal muscles. It helps in removing blockages of the spinal muscles. So it is very beneficial for curing the spine related problem such as cervical spondylitis and other spine related pain and problems. So it is also beneficial in improving the respiratory system because it has an intense stretch, backward bending, and the front body stretch. That is why it removes the blockages of the respiratory system and improves the functioning of respiration, such as the person suffering from the asthma and the bronchitis. They would be helpful for them. The performing this asana is very beneficial. The person who has a respiratory related problem such as the asthma and bronchitis and other respiratory problems. So now the next benefit of this asana is it helps in removing the pain in the knee, neck and the back. And it is also beneficial for the abdominal health. So it stimulates the digestive organ and it stimulates also the excretory system. So it is also helpful in controlling the abdominal related problems, and it is also improving and controlling the blood sugar levels. So basically, it is also helpful in controlling the diabetes also. The precautions and contraindications of this asana are the person who has the high or low blood pressure, they should not perform this asana because again, when the sudden shift of movements can create the blood flow disturbance. When this disturbance happens, what happens? It can exaggerate the symptoms of high blood pressure or the low blood pressure. The next one is the person who has the neck and the spine pain, they should not perform this asana because it has an intense spine and neck stretch and front body stretch, so it may exaggerate the pain symptoms of the person. So they should not perform this asana. The next, the person who has the balance and the vertigo issues, they should also not perform this asana because Ardha and the Ustrasana requires lot of balance, and the person suffering from the vertigo, when this is a back bend posture, so when the person performs a back bend, so the vertigo symptoms can exaggerate or it can harms at some level. So they should not perform this asana. The next, the pregnant woman is especially try to avoid this asana because this asana exerts lot of pressure on the abdominal muscles, so it can harm the fetus of the pregnant woman. So especially if they would like to perform, they should consult to the expert trainer. Now, come to the next, Ustrasana. The Ardha is the preparatory pose for the Ustrasana. It is a complete camel pose. Again, Ushtra means camel and Asana means pose. So it is known as for the complete camel pose, in which it has a intense front body stretch and the back bend stretch. So the back bend stretch, so it is very beneficial for the spinal health. The people suffering from any kind of spinal problems, they may cure from the practice by practicing this asana. Now, this asana is also helpful for the heart health. It may remove the blockages of the heart and helps in improving them and curing the heart related symptoms, so that it is beneficial for the cardiovascular health. And the last but not the least, it improves the entire it stimulates the functioning of entire nervous system, so it is helpful in removing the negative energies of a person and negative emotions of a person, such as it helps in uh, removing or reducing the stress level, anxiety, depression, and any kind of self-esteem issues. So by performing this asana, the mental health related problems can be cured by performing these asanas. Now, come to the precautions and contraindications of this asana. Again, the person is suffering from high and low blood pressure level, or who has the severe spinal injuries or any kind of injury, they should not perform this asana. It is also harmful for the pregnant ladies and the person who has balance and vertigo issues, or the migraine and insomnia, the person suffering from, they should also try to avoid this asana. Now, I'm going to discuss the next series of asana that is also based on the Vajrasana series. The next one is Shashankasana. Shashankasana is also a Sanskrit word and it comes from the Shashank. Shashank word means the moon and the asana means the pose. So it is known as the moon pose. And the another name of this Shashankasana is Sasank. Sasank means the rabbit or hare and the asana means pose. So it is also called the hare or rabbit pose. So the both of the name are considered in Shashankasana. So the Shashankasana is very helpful asana for the mental health. It is the hallmark of the mental health and it is used for the mental wellness because it removes all the negative energies of the it removes all the negative energies of the mind related problems. So it helps in curing the stress, depression, anxiety, and any other mental health related issue can be cured by performing this asana. And this asana is also useful in mental health care system uh, in a wide range. So it is a hallmark of the mental wellness. The another benefit of this asana is it helps improving again the spine related problems because it has a front banding, band bending, band forward stretch. So that is why it improves the spinal health. The another one is it improves the cardiovascular health also. Now, it also improves in curing the pain symptoms like knee pain, back pain, and any type of pain that is disturbing the person or the stiffness, and it improves the flexibility. So there are some also precautions and contraindication of this asana are, so the person who is suffering from high blood pressure, they should not perform, or the person who has the severe migraine and insomnia symptoms, they should not perform this asana. And the person who has severely respiration related problem, they should not also perform this asana. In this asana, the one point should be noted down that the person should not take a very long and deep breath while performing this asana because it has an intense stretch. So the deep breath uh, can negatively impact the person's health. So, while performing this asana, the person has to take the normal breaths. Now, I'm going to demonstrate this asana. So, Let's start with the Mandukasana. Sit comfortably in Vajrasana. After that, raise your both of the hands and close the fist. While clenching the fist, keep inside your thumb in the fingers. Now, bring both of the fists towards the navel and slightly press the navel and exhale the air completely and then bend forward. While bending forward, keep looking straight in front of you. Hold the breath while you are in the position. Then hold this position as much as you can. Now inhale and come back to the normal position and release the fist and keep your hands on the knees and take some normal breath. The another asana is the Uttan Mandukasana, which is another variation of Mandukasana. To perform this asana, just wide your knees, wide apart as much as you can. Now, raise your both of the hands above the head. And now, bring back the right hand towards the left blade of your left shoulder and keep the palm on the left blade of the above shoulder. Now, bring back the left hand and keep it on the right blade of shoulder. Now, both of the hands should cross each other and hand should be straight and feel the stretch to the front body and the hands. Now, inhale and bring back your hands on the knees and close your knees. Come back to the normal position and start taking the normal breath. The another asana is Ardha Ushtasana. It is also a form of Vajrasana. So, sit comfortably in the Vajrasana and next stand on the knees to perform this asana. Now, maintain the little distance between both of the knees. Now, raise your both of the hands and raise your left hand above the head and keep move towards the left side, little twist towards the right and try to touch the right heels and keep the right hand towards the towards upward and keep looking at the right hand. This is the position of Ardha Ustrasana. Now, inhale and come back to the normal position. Keep your hands on the knees and close your knees and sit on the knees. Now, take some several normal breaths. Now, I'm going to perform another asana, that is Ustrasana. For the Ustrasana, again we have to stand on the knees and take a distance between both of the knees. Now, raise both of the hands. Raise above the head your left hand, then bring back and reach towards the left heels. Try to touch the left heel or the ankle of the left hand.
3 लोग कुल participants हैं उनमें एक
Raise
मैं
your
हूँ
right hand above the head, bring it back, then try to touch the right heel or the ankle and simply back your head. This is the position of Ustrasana. Now inhale normally and come back to the normal position. Sit comfortably on knees. Close your knees. Put your hands on the knees. Now take again some several breaths. Now, the last is Shashankasana. This is a very simple asana. For that, raise your both of the hands. Inhale and raise your both of the hands. And while exhaling, bend forward and try to touch your hands on the floor and touch your forehead to the floor. This is the position of Shashankasana. Now inhale and raise your both of the hands and bringing back while exhaling. Now come back to the normal position. Keep the hands on the knees. So these all are the 5 asanas are from the series of Vajrasana. I hope you understand very well. Now I'm going to start the Q&A session with Rashmi ma'am. I'm inviting the Rashmi ma'am. Please join this session and we are going to start solving your queries. So start asking your questions.
You can turn on your mics for your queries. If there is any question, you can please ask for us.
I hope this session is very useful to you and you understand very well all the asanas. If you have any query regarding the today's session, you may ask. Or you would like to ask about the subscription process, you may ask for, right?
Is there any query? You can turn on your mic and please ask freely from us regarding the session. So today we discussed about the sitting postures. Is there any question in your mind regarding the sitting postures? You can freely ask from us. If there is no question, so we will end this session here. Thank you for joining us.
Thank you for your kind support. Stay happy, stay healthy.
Namaskar.